In the name of Allah, who is most merciful and most beneficent. I'm Dr. Ambreen, and today I'm going to deliver you a lecture on medical ionization. This topic of medical ionization is from the subject or course Physical Agents and Electrotherapy 1. Now the point is, what is medical ionization? Medical ionization is also called interferosis. It is a process of transdermal delivery of drug by the use of voltage gradient on the skin. So what is going to happen is the molecules are transported across the stratum corneum by electrophoresis or the process of electroosmosis. Electrical field is going to increase the permeability of the skin, and so we use them for the purpose of therapeutic introduction of ions into the tissues. What you are going to do in this medical ionization is you are going to introduce some medical ions, and you are going to apply the direct current, and you are going to introduce those ions into the tissues of the body with the help of some electropulsive forces. So first of all, we'll discuss what is constant direct current, which is actually we are going to utilize in the medical ionization. Constant direct current is a unidirectional current of unvarying intensity. We also call it constant galvanism. There are two basic physiological effects when you are going to apply any direct current onto your skin. So they need to be discussed because they are very important, because we are going to utilize this current. These physiological effects are vasodilation. The other one is polar effect. Vasodilation is going to appear when you are going to apply this current on the skin. The skin is going to show a response in the form of vasodilation or redness of the skin. So erythema of the skin is observed when the pads are removed from the treatment, especially at the level of the cathode, at the point where it's cathode applied. So as a result of vasodilation, there is increased blood supply to the superficial tissue, which produces a sense of warmth experienced during the treatment. The reason, the point here is why this vasodilation is going to occur when you are going to apply this current. So there are several theories to justify this vasodilation. The first point, according to this, one of the theory is, so it may be due to the moving ions stimulating the sensory nerves endings, causing the reflex dilation of the blood vessel. As we have discussed in the Faraday type current and interrupted direct currents, whenever you apply some current on your tissues, there are sensory nerve endings present in the skin that is going to show the response. The moving ions stimulate those sensory nerve endings, and they causes the reflex dilation of the vessels. It may be due to the irritation of these cells, and maybe due to the liberation of the H substance when histamine release is going to occur when you are going to stimulate the sensory nerve endings. And they are going to show a triple response: dilation of the caprioles by direct reflex, dilation of atrials by the axonal reflex. Or ultimately, when there is a dilation, vasodilation, there is obviously increased permeability of the vessels, so leading towards a local edema. Vasodilation may be due to some mechanical actions of the moving ions bombarding the walls of the vessel. So when you are going to stimulate, there is obviously some motion or mechanical action of the ions that are going to cause bombardment on the walls of the vessels, and they are ultimately going to cause vasodilation. So vasodilation is increasing the permeability of the vessels, and so ultimately we also have slight local edema around that area. The next is the polar effect. These are the effects produced in the tissues immediately under the electrodes and differ at the level of the anode and cathode. We have two types of electrodes, anode and cathode. So the effects are going to vary according to the position of the anode and cathode. So before starting medical ionization, we must know the following terms: electronis, electrophoresis. Then what is going to happen when you are going to introduce the ions into the tissues by the process of interferosis, and some chemical effect. Electronis. Electronis is the effect upon the nerve conductivity and excitability when you are going to apply the constant direct current. So when the constant direct current is applied with the one electrode, with any one electrode, the strength of the contraction may be modified. It can be anelectronous, it can be catelectronous. What is anelectronous? Electronous is an decreased excitability and conductivity of a nerve in the region of the anode. So I said earlier there are two sorts of electrodes. One is anode and the other one is cathode. So at the level of the anode, when you are going to apply, there is decreased excitability and conductivity of the nerve. While we're soon going to tell you the level of the cathode, there would be increased excitability and conductivity of the nerve of where you are going to apply. So if the anode is applied, the strength of conduction is obviously being reduced, as the anode has the effect of decreasing the conductivity of the nerve. While at the level where you are going to apply the cathode, there is increased excitability, increased conductivity of the nerve. Both are basically due to the development of the potential difference across the plasma membrane of the axons of the nerve as the current passes through it. The potential difference developed under the A node, the previous one, augments the normal resting potential difference, so it makes difficult for the impulse to pass. While at the level of the cathode, it reduces the resting potential difference and increases the conductivity of that area. The next is electrophoresis. It is the movement of the ions into the solution according to the electrically charged current acting on them. To understand this process of electrophoresis, we must have understanding of cathode and anode. As we have earlier studied in our previous subjects, what is cathode? We are going to revise it. It is a negatively charged electrode. Highest concentration of the electrons are present here. It repels the negatively charged ions and obviously attracts the positively charged ions. While at the level of the anode, there is positively charged, it is a positively charged electrode. Low concentration of electron is present, so it repels positively charged ion. It attracts negatively charged ion. So they attract opposite charges and they repel the same charges. This is a picture just to depict you on like a brief like idea of interprocess. This is the anode, this is the cathode. You can see they have placed some sodium ions under the anode and the chloride is present here. As we know, same charges repel the same. For example, under the anode, which is a positively charged like electrode, you are going to place some positively charged ionic drug. Like you are going to place sodium ions under the anode, and you are going to on the current, and you are going to pass the current. What happens is when the current passes through the anode, it will obviously repel the positively same charges away from it and push these ions to go into the tissues of the body. And like due to this repulsive the forces, it is going to push or introduce these ions into the tissues. I'm again going to revise this concept of medical ionization, which is a non-invasive method of introduction of therapeutic ions into the tissues by the action of the constant direct current. Medical ionization is also termed as iontophoresis, mean ion to mean ion, phoresis mean transfer of the ions. The non-invasive mean the approach in which you are not going to like do some open like the surgery, or you are not going to inject something. This is a closed procedure. And this procedure, what you are going to do is you are going to introduce ions into the tissues. So how you are going to introduce these ions? You are going to place the same kind of ions, same charges of ions under the same electrode. For example, I'm again going to give you an example of anode. You are going to place the positively charged ion under this anode. So what is going to happen is when you are going to apply the current from here, this anode will repel these charges and push these charges to move into the tissues. So it is a technique of introducing ionic medical compounds into the body through the skin by application of direct electrical current. For example, this is an electrode and this is of the same kind. For example, again, I'm going to give you an example. It's an anode and you are going to place these positively charged blue ions under the anode. So what is going to happen is when you are going to apply the current, this electrode is going to pull these ions into the tissues, and in this way the current tends to like cause application of these ions into the tissues. The next is the use of iontophoresis was first reported in early 19th. In this method, the transdermal drug delivery, each substance is separated into the ionic compounds and by the action of the current and deposited subcutaneously according to the imposed polarity of the electrodes. So the primary route of the ion transfer across the skin is thought to the skin pores and hair follicles. Most recent studies also suggest that iontophoresis may promote the transdermal drug penetration by increasing the probability of the stratum corneum, which is the main barrier of the transdermal drug uptake. As we know, our tissues contain ions, so when you apply the current, there is conductivity in the tissues due to the presence of these fluids and ions in that body. But some tissues, like epidermis, has a high resistance because it has a less fluid content. The conductivity of the tissue depends upon the ionic fluid it has. Like the muscles are considered to be good conductors because they have a high blood supply or good blood supply, while the fats are considered to the poor conductors just because they have a poor blood supply. So the conductivity of the tissue varies according to the amount of the fluid it contains. So therapeutic results from the therapeutic results depends upon the iron you are going to introduce. How much iron you want to introduce in the body depends upon the iron you are going to introduce, then the pathology that is present, and the desired effect. Theory of the interferosis. Substances which are to deliver into the tissues need to be ionic in nature. The very important thing about this is the drug you are going to deliver through this process must be ionic in nature. Iron must place under the electrode with the same charges. For example, if you are going to introduce positively charged ions, you must place them under the anode. So if you are going to introduce negatively charged ions, you must place it under the cathode. So the same charges repel the ions into the tissues. Anode repels positively charged chemicals and cathode repels negatively charged chemicals. Active electrode. The electrode under there are two electrodes we earlier studied in the different lectures that discussed it. One is active and the other one is indifferent. So active electrode might be anode or active electrode might be cathode. So it depends upon the ions you are going to introduce. If my ions are positively charged ions, so my active electrode would be anode. But if my ions are like negatively charged ions which I want to introduce, my active electrode would be cathode, and our indifferent electrode obviously would be anode, vice versa. So when the current is passed, there is an interchange of the ions between the path and the tissues. This is again a picture just to show you. This one is your active electrode. You are going to place the same kind of the charges under the electrode, and this one is your indifferent electrode, the one that is opposite in polarity, and it is going to complete the circuit. Now we are going to prove that ions really enter into the tissue. This is experiment that was actually done by Lidius, who proved that ions entered into the tissue by the influence of the current. He took two rabbits, you can see in the picture. He took two rabbits, rabbit A and rabbit B. He placed them in a series, and this one is your right now cathode, and this one is the anode. The near one towards the negative terminal is your cathode, and the other one is your anode. This one is black one is your cathode, and this one is anode. What he did is he dipped one anode and one cathode in a solution of strychnine ions. Strychnine ions are actually poisonous ions or poisonous material, and he took one cathode and one anode, and he dipped in the solution of strychnine ions, and the other electrodes in some harmless solution. So on one rabbit, the cathode was placed over the pad containing strychnine ions, and the anode. The strychnine ions actually be a positive charge. So when the current has passed, the rabbit with the pad containing the strychnine ions under the anode A died, while the other rabbit B was unaffected. So this theory proved that the positively charged ions are being repelled by the same electrode, same charge electrode mean anode. Thus the entry of the ions was just due to the repelling effect of the anode, not due to the absorption through the skin. There are some other evidences. A visible reaction of the superficial tissues following the certain ionization, such as histamine and zinc, when applied to the wound. So following the ionization with the lithium, the ions may be detected in the urine, although they are not normally present and could not have come from any other source. So what they found is when they introduced the lithium ions, they ultimately found the detection of the particles of the lithium in the urine. They actually obviously had the evidence that it means the lithium actually was introduced, so it is right now present in the urine. Ion penetration. Penetration of the ions is generally less than 1 millimeter. Subsequent absorption to the deeper tissues is through the capillary circulation and transmembrane transport. Some studies also demonstrate the penetration of the ions may be to the level of 3 millimeters to 20 millimeters. Then how much components you are needed to introduce this effective transdermal drug delivery? For this purpose, you need a power supply, you need electrodes, you need negative or positively charged ions of aqueous medication, and localized treatment area. You need a power supply, means power source. You need electrodes, means through which you are going to apply. You obviously need a solution. It may be negatively or positively charged solution that you actually need. You apply. Then and the last one is the treatment site on which you are going to apply. The power supply, electrodes, the aqueous solution, and the localized treatment site are main components you are needed for the effective interferosis delivery. But the point is the number of the ion introduced in the tissues depends upon, how much ions you are going to introduce depends upon the intensity of the current for the duration of the treatment for which you are going to apply. The intensity of the current, obviously, if the higher would be the intensity, higher would be the repelling force. For the longer duration you are going to apply, for the longer duration you are going to introduce ions. This is a picture of a commercial electrode that is present in the most of the interferosis system. This is an electrode. There is you can see a nozzle, a point of the ion injection. This is a like chamber of this. This is the semi-permeable membrane. So what is going to happen is the electrodes have a small chamber covered by semi-permeable membrane into which the ionized solution may be injected. So the electrodes self-adhere to the skin. These electrodes adhere to the skin, and you are going to inject the solution into this chamber, and then ultimately it is going to pass through this semi-permeable membrane and going to transfer to the ions when you're going to apply the current. So it depends upon the ions you are going to introduce. So it depends upon the lead you are going to connect it either with the positive terminal or either with the negative terminal. The next is electrode preparation. So to ensure the maximum contact of the electrodes with the skin must be shaved and cleaned prior to the attachment of the electrodes. So when you shave the skin, don't excessively abrade the skin during the cleansing. Since the damaged skin has lowered the resistance to the current, a burn might occur easily. Then attach the self-adhesive electrodes to the skin. This is the picture you are going to, this is going to attach the electrode to the skin. Then inject the ionized solution into the chamber. The next is attach the self-adhering indifferent electrodes and attach the lead wires coordinated to each. This is a picture to show you like application of the process of anti-process. The size and the shape of the electrodes can cause variation in the current density, like smaller, if the size, higher would be the density. So electrodes should be separated by at least the diameter of active electrode. Wider the separation minimizes superficial current density and decreases the chances of recurrence. This is a table of the ions in the form the sources from where we can get these ions according to their polarity. I'm going to introduce them. These are the indication mean acetate ions are going to cause the calcium deposits over the tendons. In these conditions, it will use acetate ions. It will use chloride ions for the cyclolytic effects, for adherent scars. For fungal infections, we use copper. So you have to understand the indications, and then you must like memorize the ions you are going to apply, and also know the polarity of the ions. This is very important because if you know the polarity, you must be able to place under the same electrode under which you actually need to apply. For example, what would be the effects of the ions if they are negatively charged? If the following are the ions that bears negatively charges, so they are always like introduced under the cathode, like iodine, chloride, salicylate, and bucine. Iodine are the ions that are obtained from the solution of the potassium iodide. They are effective saccharolytic agents. Saccharolytic means lytic is lysis of the, like you can say, adhesions, or you're going to break these adhesions by the application of the iodide ions. They are also an excellent bactericidal in action. Bactericidal means to kill the bacteria. So bactericidal agents are those that are going to kill the bacteria. They are also vasodilator in nature, iodine ions. So these are the following characteristics of iodine ions according to which we can use them. The next are effects and uses. When you are going to introduce these iodine ions through the electrode, an irritating effect on the superficial sensory nerve endings occur. So they increases the vasodilation. They also relieve the pain by the process of counter irritation, which is normally obtained at the level of the cathode. Counter irritation is a phenomena in which you are going to give a counter irritant that is more like intense, so it is going to suppress or mask the previously present pain. So by this process, you can also relieve through the pain. They are used in the treatment of chronic inflammatory lesion. They are also being used to soften the superficial scar. This effect is probably due to the increased blood supply. As I said, when we apply them, they cause irritation. When they cause irritation, there is vasodilation. So whenever there is a vasodilation, you mean to say there is increased blood supply here, and the blood flow is actually being reduced. So the blood that is coming here has more oxygen, more nutrition. So it is going to like cause the softening of the superficial scars. Then chlorine ions, they are obtained from the solution of the sodium chloride. They are also saccharolytic agents. They are useful in the conditions where you want to resolve the scar tissues and burns. They are commonly used for this purpose of softening of the scar tissue. But the effects are probably due to the entirely due to the action of the cathode. They are most prominent under the cathode. The next is salicylate ions. They are obtained from the solution of salicylates, sometimes used in the rheumatic condition. Rheumatic condition are inflammatory conditions that are going to affect due to the autoimmune issues going to affect the joints and other tissues of the body. So it is likely that the salicylate ions reach the site of the lesions. Main effect is probably the main relief of the pain from analgesic effect. The salicylate ions on the superficial sensory nerve endings cause like a counter irritating effect. Albucid obtained from the sodium sulfacetamide solution. They destroy the certain bacteria. They are bactericidal in action, and sometimes also used in the eye infection, being a bactericidal in nature. Now, positive ions. The positively charged ions, zinc and copper ions, are commonly being used here, and we're going to use in certain conditions. They are actually bactericidal in action, commonly being used for this purpose. Zinc ions are obtained from the zinc sulfate solution and zinc chloride. Bactericidal in action, so used in infected superficial wounds and infected sinuses, ear infection, in certain eye infections. The hay fever is also an autoimmune condition in which there is antibody interaction and causes inflammation of the nose, mucous membrane of the nose. So if the wound is treated with the zinc ionization, the infected or indolent superficial layers of the skin are destroyed by this purpose. The wound is sterilized and the layer of the zinc albuminate seals the surface and prevent the entry of the bacteria. We are going to discuss this zinc ionization in detail. Don't worry. The next is copper ion. Solution with the copper sulfate is being used for this purpose to obtain the copper ion. Skin conditions and fungal infections are being treated with these copper ions. They are having similar effects like the zinc ions, so they can be used instead of zinc. There are certain other ions like histamine and rhinotine. They are used for the vasodilator effects in certain conditions. So where you are going to use histamine, it is going to cause a triple response, dilation of the capillaries by the direct action of the histamine. This is a direct response of the histamine that it dilates the capillaries. Then there is the dilation of the arterioles, exudation of the fluid, and local edema obviously occur when you are going to vasodilate the vessel. So there is increased permeability. Due to this increased permeability, there is the exudation of the fluids and local edema. So symptoms for this in this condition is flushing of the face and the neck, giddiness, is drowsiness, prickling feeling in the eyes, increased pulse rate, and headache also. When you are going to use histamine, in this technique you recline on a couch. The patient is going to recline on the couch and fully supported place. A pulse is also taken for commencing the treatment. Indifferent electrodes is attached to the negative terminal of the source of the DC applied to some convenient area. The skin of the area to which the active electrode is applied is cleaned with either soap. The piece of the lint soak in 1 to 5,000 solution of the histamine acid phosphate is being used. Report any discomfort if present and watch for any sign of general reaction. So at the end of the treatment, the pads and electrodes you are going to remove. The skin is swabbed with methylated spirit to remove all the traces of the histamine. The patient should rest after 3/4 of an hour to allow the pulse rate and blood pressure to return to normal, and want to take any strenuous or any serious exercise for some hours. Then is the rhinotine ionization. This process is similar with the rhinotine ionization as with the previous histamine ionization. The next is the amount of the current the type of the current you are going to use. In this case is obviously the direct current, and it is being used with the 1 to 4 milliampere in current amplitude. For the duration is usually 20 to 40 minutes. So the total drug delivery is 40 to 80 milliamperes per minute. You are going to deliver the drug. Precaution you must take when you are going to use this process of process is skin abrasion. So if there is skin abrasion, you must apply some petroleum jelly or gel in order to equalize it and just to have an equal current density all around the tissues. Because where there is no epidermis due to abrasion, there would be like less resistance, so the current density would be higher at that area and may lead towards the burn. Remove the patient's the rings, and want the patient to remain still during the treatment and show the correct thickness of the pads for the equal delivery of the drug. The next are the side effects. If you are going to use some anticholinergic compounds, sooner you're going to use in the case of hyperhidrosis. There would be the certain effects as we have studied in pharmacology, the dryness of the mouth, restricted to general body sweating is due to this purpose. So we are going to use this in certain condition of hyperhidrosis. Contraindications of antiphlosis is pregnancy, condition where there is a congestion of the lungs and respiratory system. Advantages of antiphlosis. Virtually, it's painless when properly applied. Provide an option for the patient who are reluctant to have an experience with injection. So they also reduce the risk of infection because it's a non-invasive approach. There's medication is going to deliver directly to the treatment site. It minimizes the potential for the tissue trauma by an injection. The treatment is going to complete in minutes instead of hours. These are certain techniques in which we are going to use antiferosis in case of certain septic wounds, ulcers, or different other conditions. In a septic ulcer wound, we are going to use this antiferosis through the zinc ions. So I want to like give you a brief description. We have two electrodes, active electrode, and another one is indifferent electrode. Active electrode is going to placed over the wound or ulcer, and under which we are going to introduce some zinc ions. Active electrode is our anode, and anode is positively charged as our zinc ions are positively charged. So the other electrode, that is cathode, is going to place some convenient area, and you are going to apply some high current density. So first of all, before applying the electrode, we are going to clean the wound. For example, I have wound here, and I am going to clean it with 1% zinc sulfate solution. Then any scab and rough material I am going on the skin, I am going to remove it. The skin is then dried after like cleaning it with the zinc 1% zinc sulfate solution, and after drying the skin, the pad of a sterilized gauze is soaked with the zinc sulfate solution is going to fix over the wound. So first of all, what I did is I dried it or sterilized it 1% zinc sulfate solution. Then I dried it. Then I'm going to place a pad of sterilized gauze with zinc sulfate solution, and then going to fix it. Then a piece of cellophane or paper like layer, rather larger than the pad, is cleaned with a methylated spirit and then placed on the top of the wound. I'm going to place a piece of cellophane that is larger in area so that I cover the gauze properly. So the purpose is to prevent the entry of any bacteria anymore. A pad of lint is soaked in the tap water and applied over the cellophane. Then the electrode is connected to the positive terminal. This electrode is going to connect it with the positive terminal and of the source of the constant current, and the pad may extend beyond the edges. So the pad should be in such a way that it covers all the edges of the wound. The dose we are going to apply is 30 millimeters per minute per square inch, being suitable. Assessment of the treatment duration. How we will assess that treatment has been completed. So there are certain points you must consider when you are going to complete the duration. That is, the gauze under the cellophane should be adherent to the surface of the wound. I have a wound and I have placed a gauze, then a layer of cellophane, then I have placed a electrode. So how can I say this? I just put a corner away and just see either the wound has adhered to the piece of gauze of the cellophane or gauze, and it must not be disturbed. Whenever you want to detach it and you want to look at, you must not disrupt the layer of the zinc aluminate. So otherwise, if you disturb it, the covering of zinc aluminate will be broken, and one corner of the gauze may be raised to inspect this instead of disturbing it more. If the surface has turned gray, an adequate treatment has been applied. If the covering of the zinc aluminate has not yet formed, the current should continue to be applied. Alternative method is continue the current to be pass until the density of the current falls automatically. What is going to happen is when you are going to apply the current, it is continuously going to move inside. So at one interval, what happens? The intensity of the current begins to fall, indicating the layer of the zinc aluminate has been formed inside, and the zinc aluminate is offering resistance. So it is indicating that your treatment session has completed. So after the treatment, a dressing of dry sterile gauze is applied over the adherent layer of the gauze. Or the treatment is not repeated for at least a week. Only 2 to 3 treatments are commonly being required. This is a picture to show you the gauze. Now we can also treat sinuses, infected sinuses, with the help of this ionization. So what is sinus? Sinus is the tract leading from the surface of the body to the deeper area. This is a picture to show you sinus. This is a sinus. You can see this is a hole that is leading to inside the body with a blind end. So for the permanent healing to occur, it is essential to sterilize the base of the sinus, to sterilize the sinus from the inside of the view. So zinc ionization is applied with the zinc rod in the direct contact with it. We apply the ionization through a zinc rod. We're going to introduce a zinc electrode in the sinus. So when the current is going to apply it with the zinc anode in contact with the tissue, when it is in contact with the tissue, zinc ions enter to the tissues. Indifferent electrode, if that would be the larger electrode, is being placed in some convenient area. The sinus is first of all cleaned with a zinc sulfate solution. The sinus that is present must be clean. So previously we cleaned the wound with the 1% zinc sulfate solution. Here we are going to clean this sinus. So in order to clean this sinus, we are going to inject 1% zinc solution inside the sinus by the help of a syringe. So we introduce a solution in the through the syringe, and then we move the solution out of the syringe and keeps few molecules of the solution inside the sinus, so that zinc ions may reach the parts inaccessible to zinc electrodes. The rod previously sterilized by the boiling is introduced into the sinus and the current is applied. The dose may be assessed in milliamperes minutes per inch of a rod, and 30 milliamperes minute per inch being suitable, or the current applied until the intensity falls. So when the current turned down, it is found that the zinc rod is adherent to the walls of the sinus. It poses a problem, so it can be loosened by reversing the polarity and applying a few milliamperes of the current for half or 1 minute. They want to say when you are going to complete the session, what you found is your rod is adherent to the walls of the sinus. So in order to like pull this electrode out, what we have to do is we will loosen the zinc aluminate layer. We will do it by reversing the polarity for half or 1 minute. We can also deal with the scars with the use of medical ionization. Scars are adherents of fibrous portions of the skins. So you can treat them by, as this is going to cause vasodilation, so they soften the scar tissue as it can be stretched and freed from the surrounding structures. The aim of the ionization is always here in this case is to increase the blood supply and the exudates of the fluid into the tissue. So ions we can use is histamine, rhinotine, iodine, and chlorine for these purposes. The surrounding skin, for example, I have a, you can say, I can show you. For example, here I have a scar. So what can I do is I am going to use petroleum jelly around it, so that the current that I am going to apply with the electrodes have, this is your electrode, the skin one is your electrode, and the circular one is your scar. So what is going to happen is when I am going to apply my current through the electrode, the current may pass through the surrounding tissues where I don't require this process of ionization. I want to deliver all my drug to the area where it is required. So what I do is I apply petroleum jelly around the scar, so that when I place my electrode, it does not. This petroleum jelly does offers resistance, and so due to which the current would not be able to pass through the tissues. It only passes through the scar. So skin has a low resistance, the scar, so it were not being protected, very little current would pass through the scar itself. The dosage I am going to apply is not more than 1 milliampere of the current per square inch of the scar, so it must be applied for 10 to 20 minutes. You must always carefully observe the effects after and during the treatment. So at subsequent treatment, only if there is no severe reaction, you can progress according to that. Hyperhidrosis. Hyperhidrosis, hyper means excessive, hydrosis means sweating. So hyperhidrosis is a term that indicates excessive sweating. So what is going to happen is we are actually using medical ionization to treat excessive sweating on the hands and feet. You often heard there is excessive sweating on the hands and feet of some individuals. So in 1940s, this concept was introduced that we can use the process of medical ionization, the patients who have excessive sweating in the palms and in the feet. So there are certain studies being conducted to elaborate this concept of medical ionization in the patients with hyperhidrosis. So one study have showed that interferosis helped about 91% of the patients with excessive palmoplantar sweating. Another study has suggested that this interferosis had showed relief in sweating, and it about 81% of the patients. The next is Greece was the person who introduced effectively introduced this process of interferosis in 1980, and he used tap water for this purpose, and by using tap water there were no side effects. But you can also use some anticholinergic compounds in case if you required. But he have offered faced some, you can say, some problems, like some geographical locations showed tap water that is very soft in nature. It does not have some minerals and ions, due to which it is not going to properly dry the sweat gland. So for such issues, we use baking soda in water, and baking soda eliminate some problems that we're going to face in some geographical condition areas. So, in this purpose, we can also use anticholinergic compounds. As we know, cholinergics, acetylcholine is going to increase the secretion of all the glands, while the anticholinergics are the compounds that are going to decrease the secretion of the glands. So, atropine and the members of glycopyranonium bromide can be used instead to cause the decrease in the gland secretion. The reduction of the glycopyranonium bromide under the anode electrode has shown to have long-lasting effect, and Morgan in 1980s introduced this glycopyranonium bromide for the process of hyperhidrosis. The machine should be tested prior to the use and leads rail attached to the terminal. We can also use antiphrosis in patients of otitis media. Otitis media is a condition in which there is inflammation of the middle ear behind the tympanic membrane, may result in the formation of the abscess. Chronic discharge of pus may occur. So, zinc ionization proved very beneficial, and it is bactericidal in nature. Ear is cleaned with a strain and then syringed with a warm solution of zinc sulfate. Zinc sulfate 20 grams, glycerine half ounce in water to prevent the solution is like being introduced in the air. At the end, solution must be left in the middle ear and the external auditory meters, and different electrode is applied to some convenient area, and the active electrode is connected to the anode, and current is going to be applied and passed for 10 minutes. The ionization is repeated at weekly intervals. 2 to 3 sessions are being commonly taken for this purpose. The last one is ionization for the treatment of eye. Corneal ulcers can be treated with zinc ionization. Iodide ionization may be proved beneficial in corneal opacities. Zinc and iodine ionization is being used for keratitis, inflammation of the cornea. Sulfacetamide ionization is being used for intensive conjunctivitis. The technique is similar as like other like situations, but what there is some in certain indications like precaution. The patient is treated in a lying position and indifferent electrode is placed to some convenient area like forearm. The eyelids are inspected and any abrasions is protected by petroleum jelly, and 0.5% solution of potassium iodide, zinc sulfate, sulfacetamide is being used, and a drop is put on the medial corner of the eye. You can place a drop of the solution in the medial corner of the eye, and what is going to happen is then the patient is asked to blink the eye. So when the drop is being placed at the medial corner and then the patient is going to blink it, the solution runs over the eye and the eyelid is then closed and damped with the solution. A pad of white wool soaked in the solution of the solution is and again being placed over the closed lid. Extra padding is done on the hollow surface in the medial corner of the eye to equalize the surface. Then electrode is usually applied in the top of this and this should be light as possible. A special copper gauze is being used for this purpose. For zinc ionization, the active electrode would be obviously anode. For iodine and albucid ions, the active electrode would be cathode. You're going to apply the current for 20 to 30 minutes. If the eye is stinging or being irritated after treatment, it must be bathed with the distilled water. These are some pictures of the commercially available antiphrosis electrode, and for the antiphrosis process, you can also see this. These are for the hyperhidrosis. These are the patients who are being exposed with electrodes, and then they are going to be placed their hands. One is going to act as active electrode, the other one is indifferent electrode. Patients usually undergo this process of ionization, especially for the issues of hyperhidrosis. So this was all about the medical ionization. Inshallah, see you in the next lecture of the physical agents and electrotherapy. Till then, Allah Hafiz.